Welcome back. This is the podcast finale, meaning this is the last one. This is podcast 10 of the 10 episode series, Navigating Depression and Anxiety. I am your host. My name is Niama. My friends call me Nia. So this amazing podcast with 10 episodes, from understanding depression and anxiety to coping strategies, overcoming stigma, building a supportive network, therapeutic approaches, lifestyle and mental health, navigating medication, as well as overcoming negative thought patterns, and mindfulness and meditation, to tonight, July 20th, 2023, finally the last episode of this podcast, seeking professional help. Super important, my beautiful sisters. So, navigating depression and anxiety, finding light within. I'm going to cover a range of different strategies so you are able to have the valuable information and the practical tips to help you make positive lifestyle choices while you're going through depression and anxiety, if you do, because I went to seek help when I need it, and it's super important that you also seek professional help. So, seeking professional help, tonight's 10th episode. Seeking professional help, tips for finding the right therapist or mental health professional, discussing different therapy options, and demystifying the process of seeking professional support. I'm here to help you, my beautiful sister. And remember, you need to understand what depression is. You need to understand what anxiety is, so you are better equipped to take care of yourself, to heal. Love yourself. Remember, it's about self-love, self-care, and regaining confidence and your self-esteem. So if you're dealing with depression and anxiety, it's essential to seek professional help for the proper treatment and support. So I'm going to give you some steps you can take to get the help you need. So number one, reach out to a healthcare professional. Start by contacting your primary care physician or your healthcare provider, because they can assess your condition, provide an initial diagnosis, and also refer you to a mental health specialist if necessary. If you don't have a healthcare provider, consider finding a therapist or a psychiatrist in your neighborhood, in your area. Number two, find a mental health specialist. So look for a licensed therapist, psychologist, or even a psychiatrist who specializes in treating depression, anxiety, panic attacks. You can also go online. There's some directories, and ask for recommendations from your friends, trusted family members, neighbors, or you can consult your insurance provider, because they always have a list of in-network providers. Just consider factors such as their experience, their approach to the treatment, and also their availability. Number three, you need to schedule an appointment. So you will contact the mental health specialist and schedule an initial appointment, because some practitioners offer a brief phone call beforehand to discuss your concern. You are able to actually be over the phone and talk to them for different treatment options, and also determine if they are the right fit for you. Number four, just be open and honest. Like I said earlier, honesty is the only policy. So make sure to be honest. Tell them what is going on with you, how you are feeling. During your appointments, just be honest, be transparent, be open about your feelings, your symptoms, how you feel deep down, and also your experiences. So you have to share your thoughts and also your concern, because that will help the mental health professional better understand your condition and also develop an appropriate treatment plan. Number five, follow the recommended treatment plan. Always follow it. So based on your assessment, the mental health specialist may recommend a treatment plan, which can include therapy, medication if absolutely necessary, or a combination of both. So it's very important to follow their recommendations and also be consistent with your treatment. You need to attend therapy sessions as schedules, And also you need to take medication as prescribed. So however, if you have any concerns or if you experience any side effects, right away stop the medication, and you need to communicate and let the provider know so they can make the necessary adjustment. Number 6, consider therapy options. So different types of therapy can be effective for depression and anxiety. Before, in my previous episodes, I talk about cognitive behavioral therapy, CBT, because this one is the one that is commonly used. But there's other approaches, such as mindfulness-based therapy, dialectical behavioral therapy, also known as DBT, also interpersonal therapy, IPT. They may actually also be beneficial. So you just need to discuss the options with your therapist to determine what is the best fit for you. And just ask them for their advice, ask them for their expertise. They know better. They're supposed to know better. Number 7, build a support network. I mentioned that in my previous episode, building a supportive network. That's episode 4, and I did that in July 11th. Go back in this channel, Healthy Living, and listen to the episode, Building a Supportive Network. So you need to do that. So you have to reach out to trusted friends, family members that care about you, that love you, support groups, because they can provide understanding as well as encouragement throughout your journey. A lot of us go through depression and anxiety throughout our life. Children, teenagers, adults, even elderly people. So don't be embarrassed, don't be ashamed. And additionally, you need to consider finding an online or in-person support group where you can actually connect with others who are going through similar experiences. It's very crucial. Number 8, practice self-care. I'm always referring that if you don't love yourself, you are not able to love other people. So remember, self-care, self-love is super important. So in addition to professional help, you need to prioritize self-care activities that will promote your well-being. You need to engage in regular exercise. I did kickboxing for almost 2 years. I've always been active. I always go outside. I walk a lot. I used to run every day. So you need to engage in working out, maintaining a balanced diet, and ensure sufficient sleep, plenty sleep, and try relaxation techniques such as deep breathing or meditation. And yesterday podcast was all about mindfulness and meditation. You can listen to the podcast episode if you haven't. So just be kind to yourself, and allow yourself breaks whenever you need it. It's so important. And just alone time, me time. If you have children, just give them to a babysitter or a family member and just spend time with yourself. It's so important. And it will rejuvenate you, spirit, mind, soul. It will make you feel so good. Number 9, stay proactive. So you are an active participant in your treatment. So you need to take steps to implement the strategies as well as the skills you learn in therapy into your daily life. So this may include challenging negative thought patterns. And that was episode 16 of the channel. Episode 8, overcoming negative thoughts and patterns. It's very important that you manage to do that. Super important. And you practice self-compassion and you develop healthy coping mechanism. Just remember that progress takes time, my sister. If you are my brother watching, listening to my videos, just be patient with yourself. It takes time. Number 10, last but not least, number 10, you need to communicate openly with your provider throughout your treatment. Maintain open communication with your mental health provider, and please update them on your progress, any challenges in symptoms, and any concerns or any question that you may have. There's no stupid question, there's no taboo question when it comes to your health, well-being, your mental health. Ask away. A lot of these people, they are there to really support you in your journey toward better mental health. So remember that seeking help is a positive and courageous step towards improving your well-being. You're very brave. You're very courageous. There's a lot of people that bottled up and they still cannot tell, they still cannot share their story. So if you are doing it, I'm so proud of you. So with the support of a mental health professional, a strong support network, and of course your commitment to healthcare, you can and you will navigate through depression and anxiety toward improved mental health. I'm living proof. I went through it. So I'm here to let you know that in this journey, you are not alone. And you will find inner light amidst the challenges of depression and anxiety. Just understand depression, understand anxiety, and just talk to someone. Find a professional that knows what they're talking about so they are able to help you. So this is it. It was a very short episode, seeking professional help. And this is the last episode of the 10 episode series, Navigating Depression and Anxiety, Finding Light Within. Thank you so much. I am your host, Nyama. My friends call me Nia. And I am so grateful for you for being here. I'm making these videos, these episodes for you. I want you to live your best life. I want you to level up, to elevate your mind, your spirit, your soul. I want you to live the best version of yourself. I want to encourage you and inspire you, as well as empower you to take actions, to write your goals down, to have vision boards regularly, and to just smile when you look in the mirror and to tell yourself, I love me, I forgive me, I am proud of me. You know, I am strong, I'm powerful, I'm kind, I'm compassionate, I'm gentle, I'm understanding, I'm a good friend, I'm a good sister, I'm a good mother, I'm a good neighbor. Just continue repeating these affirmations throughout the day, and I'm telling you, it will boost your mood, definitely. So thank you so much. Once again, my name is Nyama. My friends call me Nia. I'm your big sister, and together we can do this, okay? Thank you so much, my brother. Thank you so much, my sister. If you stayed this long, remember, as always, stay blessed, stay learning, stay focused, be unbreakable.